A San Diego trauma surgeon is back home after spending 2 weeks helping fight the coronavirus pandemic in hard-hit New York City. He shared his greatest takeaway with 10 News reporter Rena Nakano.
You guys are the one who kept this from being a disaster.
Dr. Matthew Martin knows a thing or two about the call of duty.
5 deployments to both Iraq and Afghanistan.
The former Army doctor is now a trauma surgeon at Scripps Mercy Hospital in San Diego. But for the last few weeks, he was at Jacobi Medical Center in New York City after getting a desperate call from a colleague.
One of the things he said is, we're drowning and no one is coming to help us. And that's really when I said, well, I think I can come and help.
He decided to volunteer his time and skills on the front lines of America's coronavirus epicenter. When he arrived at the hospital, Dr. Martin saw that the building was simply overrun.
We're all nervous in that kind of situation when you know that one break in your sterile protocol could mean you get infected.
Every day, he saw at least 50 patients in the ICU. Many of them were his fellow healthcare workers suffering from the disease. And the reality was, many left the hospital in body bags.
Every day, you are seeing patients die.
Despite the overwhelming sadness, Dr. Martin says he was impressed by the passion and commitment of his newly adopted team.
It was actually very similar to a military deployment where you're with a small team and they're focused on one mission and one objective.
And after 2 weeks, he says that laser-focused objective was his greatest takeaway.
Really from the bottom of my heart, because this thing is sometimes just too hard. Thank you.
With no cure yet, he says the best treatment is still prevention.
Keep doing what we're doing with social distancing, with wearing masks, and we do not want to be New York City.
A lesson he brings back to San Diego. Rena Nakano, 10 News.
After arriving in San Diego, Dr. Martin self-quarantined at a hotel before returning home. He's now back working in the ICU at Scripps Mercy Hospital, and we salute him.